Hello, everyone. Welcome to our session on understanding transplant, your options, the process, and overcoming barriers. My name is Shayla Harris, and I'm the Director of Administration at American Kidney Fund. I'm also a 14-year kidney transplant recipient and a proud advocate for the 37 million Americans with kidney disease. I'm looking forward to being your moderator for this session, where we will discuss transplant options, relevant disparities, and the transplant process to increase awareness and set expectations of the transplant journey. Now, I would like to introduce our amazing panelists today. Dr. Elaine Koo is an associate professor of the University of California of San Francisco in the Division of Nephrology and Pediatric Nephrology, and the director of the Nephrology Transition Clinic. Her specific areas of focus currently include cardiovascular risk in patients with kidney disease, disparities in access to kidney transplant and transplant outcomes, as well as risk factors for the progression of chronic kidney disease. Our next panelist is Hannah Graves. She is a transplant social worker at Piedmont Transplant Institute in Atlanta, Georgia. Prior to this work, she worked in hospice, short-term rehab, and in dialysis. She's a strong advocate for the best quality of life for kidney patients living with end-stage renal disease and patients going through this transplant process. We also have Shantae Bird, a mother of two and an active volunteer and advocate with multiple kidney organizations. She was diagnosed with lupus SLE, lupus nephritis, and kidney failure in 2008 and successfully underwent a kidney transplant in March of 2016. Shantae continues to give back to the lupus, kidney, and transplant community and looks forward to doing other projects in the community to bring awareness and education to lupus and kidney disease. Now, before we get started, I want to encourage everyone joining to please type your questions and comments into the chat box. We will try our best to get to your questions during our Q&A segment at the end of this talk. Now, to start us off today, I'd like to turn it over to Dr. Koo to share about transplant as a treatment option and what makes a good transplant candidate. Dr. Koo?
Thank you for that introduction, and thank you for having me here with American Kidney Fund. I am delighted to provide you with an overview of the transplant process and share some of the basic terminology related to kidney transplant. Can I advance my slides, please? All right, so what is a kidney transplant? So a kidney transplant is a surgery where a healthy kidney from a living or deceased donor is placed into a person whose kidneys are no longer working properly. So in this picture here, we see two kidneys, and that's the native kidneys that most people are born with two. And then you can see that a transplanted kidney is placed usually in the lower part of the abdomen in the front of the patient, as opposed to our native kidneys, which are in the back. If I can advance to the next slide, please. So when should you get a kidney transplant? Ideally, you would get a kidney transplant before your own kidneys actually shut down and you need to start dialysis. This typically happens when the kidney function is about 10% or less. Sometimes it can be a little earlier, sometimes it can be a little later. However, you can actually be registered to wait for a deceased donor kidney when your function is 20% or less and before you start dialysis. If you've already started dialysis, your wait time will automatically backdate to the date when you actually started dialysis. So you can certainly get a kidney transplant after you start dialysis, but it's most ideal if you get the process started and think about getting yourself on the kidney transplant wait list and accruing wait time when your function is 20% or lower. Even though most humans are born with two kidneys, with kidney transplant, you only need one to replace the function of those two kidneys. And so usually patients only get one kidney that is transplanted in. Next slide, please. I'm going to provide a very brief overview of the medical evaluation process at the transplant center. I think you're going to be hearing a lot more about this from our next speaker. But the kidney transplant evaluation process can take days to weeks, and it usually includes several visits with many different providers. You'll receive a physical examination. You may be asked to get imaging such as chest x-ray, sometimes CT scans as part of the evaluation process. You'll certainly be asked to do quite a bit of blood work, including blood typing to see what blood type you are. You may be asked by the transplant center to see additional specialists for evaluation. The transplant center may ask you to undergo a psychological evaluation and a social work evaluation. And there may be other tests that the transplant team decides is necessary in order for you to be registered on the wait list. So you can see that there are many items on this list, and so it's really important that you get the process started as early as possible. Next slide, please. So what is preemptive waitlisting and preemptive transplantation? This is a term that refers to waitlisting or receiving a kidney transplant surgery before you actually start dialysis. This is really preferred for multiple reasons. From the waitlisting standpoint, you want to be registered on a waitlist as soon as you can because you can accumulate extra points and wait time on the waitlist even before you start dialysis. And so that helps shorten the time before you may receive a deceased donor organ offer. Otherwise, your wait time, as I mentioned earlier, will start on the date that you start dialysis. Preemptive transplantation, so receiving an organ before you start dialysis, is always preferred because transplantation confers better quality of life, and patients have better heart and kidney outcomes when they don't go through a period of dialysis. And hence, I encourage you to really be proactive and undergo that kidney transplant evaluation as soon as you are eligible for such. Next slide, please. There are two types of donors who can donate a kidney to a recipient who is in need of a kidney transplant. So deceased donor is a person you are unlikely to know who passed away and recently agreed to donate their organs, versus a living donor who is usually a relative, a spouse, a friend, an acquaintance, someone at church that you know, or others. Living donors are always preferred because you can move forward with the surgery if the living donor is healthy and able to donate much more quickly. Donors can lead perfectly healthy lives with only one kidney. As I mentioned earlier, there are some people who are only born with one kidney and lead healthy lives. Your donor does not have to be the same blood type as you. And so certainly if you or a loved one are in need of a kidney transplant, it's always best to talk about the need for a potential living donor. Next slide, please. In terms of living donor eligibility, to become a living donor, you have to be an adult. Ideally, you would have no history of diabetes or high blood pressure or other comorbidities. You want to be generally healthy and not very overweight. And donors do have to take some time off to undergo the surgery to remove one kidney and donate that to the recipient. And of course, you have to be willing to donate a kidney. Next slide, please. So sometimes living donors are not always compatible with their recipient. Like I said earlier, you don't have to be the same blood type in order to receive a kidney from someone who's interested in donating to you. And that's because now there are programs to allow donors who are not compatible with their recipient to actually undergo what we call paired exchange programs or paired organ donation. So for donors who are not a match to their recipient, what happens is that the National Kidney Registry arranges a swap for you. What that means is that your donor does not donate directly to you, but to someone else, and that someone else's donor then returns a kidney to you. And this can often be done because you're not a blood type match, but it can also be done because the swap allows you to have a better match. Alternatively, there is also a voucher program which allows living kidney donors to donate when they choose rather than waiting for their recipient to either need the kidney or be ready for transplant. So this can also be a program that you choose to participate in if you are not a compatible donor for your intended recipient, or you want to protect the recipient and ensure that they will get a living donor kidney when they actually need a transplant. So for example, if you are healthy now and you want to donate, but you have a child who you know is going to need a kidney transplant in the future, you can participate in the voucher program and donate now and get a voucher in return where your child will receive a kidney when they actually need it from a living donor. Next slide, please. Deceased donors are screened. And so, again, this is when someone passes away and they're willing to donate their organs. They have to have no history of cancer, relatively good kidney function, and screening for infectious diseases will occur when a deceased donor is being considered. Next slide, please. So here's a comparison of the differences between a living versus a deceased donor. You can see that the average time to donate a kidney will work is much longer for living donors' kidneys as opposed to deceased donor kidneys. In terms of when the surgery will actually happen, with living donor surgeries, you can select a date that works for you and your donor, whereas deceased donors, it's unknown because it depends on when the organ becomes available. In terms of wait time for living donors, this is much shorter. The donor does have to undergo a workup. This can take 6 months to a year, but it's much shorter than the wait time for a deceased donor organ, which can be on the order of many years, depending on where you live in the US. In terms of whether the donated organ will work immediately for living donors, in most cases, you will get immediate function. For deceased donors, it is possible that the organ will take a little bit of time to wake up and work after the transplant. Next slide, please. So I'm sharing with you here some of the longstanding disparities in transplant access, which is an area where I conduct research. And so this slide actually shows you racial disparities in preemptive waitlisting. So just to review, this is waitlisting before you actually need dialysis. And you can see that over time, the trends have really not changed. What you can see is that the turquoise color and a dark blue represent Asian and white patients, and they're much more likely to be preemptively waitlisted compared to patients of other racial or ethnic groups. And this trend has really persisted over the last decade. Next slide, please. Here I'm showing you actual transplant access, so not just waitlisting, but receipt of an organ. So on the first panel here, you can see for all kidney transplants, you can see the same trends where Asian and white patients are much more likely to receive a kidney transplant. And then where you're talking about living donor kidney transplant, which is really the preferred donor source, you can see that white patients are much more likely to get a living donor kidney transplant compared to all other racial and ethnic groups. And I think this is an area that we really want to address to make sure that there is equal organ access for all racial and ethnic groups. Next slide, please. A few key takeaways that I have for you, which is that first, transplant is the preferred treatment when your kidneys or a loved one's kidneys are not working and their function needs to be replaced. I encourage all my patients and all of you to start the process early and consider identifying potential living donors, and to get registered on the wait list as soon as you qualify so you can begin to accrue wait time for a deceased donor organ. And it's really important to be proactive in the process. The process can take quite a bit of time, and so the earlier you prepare for the process, the better. Thanks again for listening, and I'll be happy to answer any questions later.
Thank you, Dr. Koo. If you're just now joining us, welcome to our session on understanding transplant options, the process, and overcoming barriers. As a reminder, we will take questions at the end of our time today, but you don't have to wait until then to send in your questions. Please type your questions and comments into the chat box, and we will try our best to get to your questions during our Q&A segment at the end of this talk. Now, Dr. Koo, quick question. What if someone goes through an evaluation and it's determined they're not a good candidate for transplant? What are some options they may have?
Thanks for that question. It's really important to understand from the transplant center why they have been determined to not be a good candidate for a kidney transplant, and to ask your transplant team for feedback. Is it that you need to make lifestyle changes? Do you need to lose weight? Do you need to address any insurance issues? And so that's really important to first understand. If sort of despite understanding and trying to address some of those factors that your transplant team wanted you to address, you're still being told by a transplant center that you're not eligible for transplant, you always have the opportunity to get evaluated at another transplant center. So you don't have to stick to one particular transplant center. You can certainly go to others for a second opinion. And then I would highly encourage you to seek out peer support to really learn from others who have gone through this experience, how they navigated situations where maybe the transplant team had requirements or criteria that they wanted them to meet before allowing them to move forward with the transplant process. And certainly the American Kidney Fund would be a great resource to also get some feedback and advice.
Great. Another question, of course. Um, does the requirement of EGFR to get a kidney for both deceased and a living donor vary by various transplant center, or is it all kind of the same?
So I think the question is about the level of function when you would undergo a kidney transplant surgery. And so that can vary from patient to patient, and it can vary from transplant center to transplant center. Generally speaking, it's really determined by how fast you're losing kidney function, how the recipient feels, whether or not they need the transplant versus they can wait a couple more months. So, a lot of factors go into the decision as to when exactly a person actually undergoes the transplant surgery. And so, I would say, as opposed to center variation, it's probably dependent on the patient situation. And in the case of a living donor transplant, it's also dependent on living donor availability. So sometimes it's related to the timing of when the donor can take time off to donate to a recipient.
Great. Thank you. All right. Our next panelist, Shantae, has her own transplant story to tell. Shantae, can you share your experience finding out about your diagnosis and what your experience through the transplant process?
Yes, again, I'm Shantae Bird. In 2008, I wasn't feeling too well. I had just lost my job. Um, I had been in my home that I purchased for 3 years. I had two kids to depend on me. Just wasn't feeling well at all. A lot of stress was going on. So I decided to go to the hospital to get checked out. Um, I stayed there for about a week. Doctors came in and told me it was my kidneys and I had to start dialysis immediately. This was very shocking to me. Mentally, it took a lot of toll off of me. Going from full-time single mom, working, not being able to work anymore. Just trying to figure out how was I going to make it, how I was going to pay bills. This was just a new environment for me. Um, I just went into shock. This was just not the norm for me. So I started dialysis in November um, of 2008. Did dialysis for 7 years. The first 3 years, they were watching me so closely because that margin that we have to be at in order to not start dialysis, I kept fluctuating in between that margin. So they watched me with hopes that things would turn around. But then I came to acceptance that another method or another treatment, because dialysis was wearing me out,
Mm.
wearing me out. But I had hope. There was another treatment, go for transplant. So I decided to get listed with Emory. There I got listed, went through the evaluation phase. Evaluation phase went very smoothly for me. I remember having, there's a certain technique that they do during dialysis, the way they flush your blood back to you, that was actually too harsh for my system. So they actually sent me over to the cardiologist, and I was able to use those records with my evaluation. So evaluation went very well. I completed everything they wanted me to do. Um, 2006 March 21st of 2016, I received a successful kidney transplant from Emory. I would like to say that my kidney anniversary is this week on the 21st. Yay. I'll be 8 years post kidney. I just had to throw that one in there. I call it my second birthday. um Also, I wanted to say that I did decide to name my kidney. My kidney name is Charity. I love the word love. Love in everything I do, everything I touch, everything I say. Everything has love in it. But I looked for another word other than love and decided to say charity. which is another word for love, which is the greatest gift we can give to one another. And I felt that was the perfect name for my kidney. Continuing on, uh, after transplant, things went well. Um, my family support, they helped me so much. I don't know. I don't think I would have made it through those 7.5 years. But I did get listed in 2012. I was listed for 4 years. Um, the call. Everyone tells you when you
Yes.
get a call, if you start getting calls, you're getting close. So I did do my first run with the call. Um, they wanted me to be on standby. But the individual that was the primary person for the kidney actually accepted it. So uh, still had hope. A little disappointing, but I still had hope. That hope is the big word, hope.
Yes.
um, then March 21st of 2016, my call came. Um, the the nurse called. I think it was a nurse, or it might have been a coordinator. That might be the right word. Coordinator called and said that they may have a kidney for me. Get ready, get your bags packed. To be honest with you guys, I didn't need a bag. I was ready to go. Really ready to go. It was
Yes.
nothing gonna stop you. I asked her, "You want me to come on right now?" She said, "No, no." So about 9 o'clock that night, they called me in. I went in. I remember signing a lot of papers. I remember being nervous. Like this was a big event for me. Nervous, shaking, don't know how to feel. I would say it was a bittersweet moment because I know what was happening on the other side of it. Someone's loved one was in transition. So I knew that that was a big thing also, with me being happy and them having to let go. Um, they did tell me uh, uh, the kidney, they set the um, surgery up for the next morning at 11. The next morning came. We did one last round of dialysis. They did explain to me, getting the kidney, you may have to do a couple more rounds of dialysis. I looked up at the nurse and said, we won't be doing another round of dialysis. We're done. We're done today. So we did that. Surgery, got in prep, went down for surgery. My family was there. We prayed. Went back. I remember laying on the table. They had already took my glasses. As you can see, I probably couldn't see. So, but I remember them asking, did I want to see it? And they held it up for it. Before I knew it, I was out. Surgery lasted about 4 hours. Um, no complications. All was well. Went back to my room where my family was. Happy to see everyone. A little sore. Um, that day went by. Of course, they give you the machine and tell you to get all the medicine you want to get because we're gonna take it away from you. The next morning, I was up and walking
Yep.
to do that victory lap around the unit and ring the bell, and I did it. I actually recorded it, so I do have that um, moment I'll never forget. After that, I stayed in the hospital about, I want to say it was probably about 5 days that I stayed in the hospital. Got my medicine straight, family caretaker, all that information straight, and I went home. Um, I would say this was an experience. I will say, um, if nothing else, I was happy that my kids, at that time, my kids were 5 and 10, and they saw mom go through so much. My kids are now 21 and 26 years old. My son is still home. He's in college. My daughter is away. She moved out. She'll be getting her master's here in May. So if nothing else, we don't give up around here. We go through, but we don't give up. Right now, I'm just I volunteer, ambassador, uh, give back to the community, teaching, letting everyone know that kidney disease is not a death sentence. You can learn to live with it. There's other the other methods that you can do as far as transplant, other than dialysis, and we know those are not solutions, but they're another method of treatment. And that's it. That's about all of my story.
Well, Shantae, thank you so much for telling us your profound story. It gives me flashbacks as well during my experience as well. Um, and happy kidney anniversary, pre-kidney anniversary. That's very exciting. You seem like a very positive, optimistic person. How did you stay that way during this time?
Um, in the beginning, it was hard. And once I came into acceptance that this was just going to be a chapter of your life, not the ending. And I learned a lot about the dialysis machine. I learned what I was actually in, the chapter you were in, not just, oh, I got to do dialysis, not learning about it, because it can be harsh to the body. So I
Mhm.
just learned a lot about that. I learned a lot about, I stayed active, my kids, my son, basketball, my daughter in school, walking and exercising, just trying to stay positive about everything. I think life is the way you look at things. You can be successful in whatever you want to do.
Thank you. If you're just joining us now, welcome to our session on understanding transplant options, the process, and overcoming barriers. As a reminder, we will take questions at the end of our time today, but you don't have to wait until then to send your questions. Please type your questions and comments into the chat box, and we will try our best to get to your questions during our Q&A segment. Now, next we have Hannah. Hannah, could you please let us know you've been through the evaluation process, um, and we'd just like to know what you would recommend or what the process looks like. Excuse me, Hannah.
Absolutely. I so appreciate you asking. I know a lot of patients that I work with can be very overwhelmed by the process, very overwhelmed by the medical system. It's just getting from the parking deck to the clinic that seems most overwhelming. But I just want to really put as my first thing to say to all of you, I'm so thrilled to be here. Thank you to Ms. Shantae for sharing her story. That is the color of this presentation is Ms. Shantae, and I'd like to put just a 10,000-foot overview of the transplant process a little bit and just remind everybody listening that you can do hard things. You are no way near any unable to do this. If this may be difficult, it's because it's worth it. So I just want to put that out in the front and just try to give you the bones of this structure and the reason why it may feel like hoop jumping often in the medical system. It's not meant to be hoop jumping. It's really meant to be for your benefit, because the last thing that the medical community wants to do to you is make life harder, as hard as it is now. And as much as you don't want to be hooked up to a machine to keep your kidney function in your body going as normal as possible, we don't want to make it worse by putting you through a major surgery and then having complications afterwards that we could have prevented if we had just known and done our due diligence. So I just wanted to put that out first and foremost, that this is not meant to be a money-making scheme by the healthcare system. As far as I know, it is not. So I'm just thrilled to be here and excited to talk to you and hopefully give you some tips and tricks on how to make it through this and know that you are not alone and that there are folks along your journey that are going to cheerlead for you and walk beside you, but you are going to be the one that's going to have to walk every step of this journey. But I'm happy to be here and hopefully walk with you on part of it. So thrilled to be here. Thanks for having me. Can you see my slides? So I just really want to kind of talk about the common themes. So you would not believe it, but there are over 200 transplant centers in the United States, and every single one does it just a little bit different. And that's good, right? Because there's interpretations, there's regional differences, there's populations to take into consideration. But it's also very challenging to have a conversation about what you can expect when you go to your transplant center for an evaluation. And so I do want to just kind of talk about like the main themes. So Most often, patients come to our transplant center when they receive a referral, traditionally from their nephrologist or their kidney doctor, that says that they are a candidate for transplant, which is determined when your glomerular filtration rate, or GFR, hits 20 or less. And so that seems to be a pretty common theme across the United States, that it has to hit that number in order for you to come forward for candidacy. Doesn't mean you're on dialysis. Not necessarily. We've seen lots of people who have not yet started on dialysis, but it is that magic number. You can also self-refer. I'll get into that in a little bit. I'm getting ahead of myself, so apologies. So first you're referred, then you come for your evaluation. Depending on what's going on with you at that time in your mental, emotional, spiritual, physical journey, kind of determines how long that's going to take. But the ultimate goal from your evaluation is that you are deemed to be a transplant candidate. You are waitlisted, and then once you are waitlisted, at some point you receive your transplant. So those are the common themes I'd like to talk more about. If I could see the next slide, please. Now I'll talk a little bit more about that referral. So you are absolutely your best advocate. And I hope that if you are a laid back kind of a person, that maybe you practice putting on your big voice, and not necessarily that you have to be aggressive, but you just have to be mindful, thoughtful, and aware of what's kind of going on. And if something doesn't seem right, please speak up about it. And we always talk about not being a jerk about it, excuse the term, but just being persistent. So you are able to refer yourself to your transplant center. More often than not, your nephrologist is more than happy to refer on your behalf. And if you are on dialysis, traditionally the referral comes from your your dialysis social worker, but it also could be sent on behalf of your nephrologist by one of the other teammates at the dialysis center. So that's the common ways that we get to see patients in our clinic, is when they come through a referral. If I could see the next slide, please. This is the evaluation stage. And honestly, I have heard so many different ways transplant centers do this. You wouldn't believe that we could all find such a different way to do the same thing, which is basically to make sure we're not doing any harm to you. That really is the whole point of going through this process, making sure that by putting you on an immunosuppressant regimen, we aren't allowing something else to take over that has been lurking somewhere. Not to give you any more anxiety about your health, but just to be very thoughtful about you as the complete package, and not just as a kidney patient. And so really every patient has to have a very strong heart. And I'm sure if you're attending, then your heart is very strong, but the kidneys and the heart are very connected. And so oftentimes when your kidneys go down and there's excess fluid on your body, your heart has to work harder, and it really stresses it out. And so going through cardiac testing is really important, because the last thing the team wants to do is put a kidney in your body that your heart can't pump blood to. So, right, that makes total sense. So if something's going on with your heart, and we know that there is, we can move forward with therapies and things that can help get your heart stronger, so you are successful with kidney transplant. No cancer, no skin cancer, no intestinal cancers, nothing. So you go through quite the workup, and you go from stem to stern. You see all of your specialty physicians, like you see your GI doctor, to have a colonoscopy if you have risk factors or family history of stomach cancers, of things of that nature, or if you're over the age of 50. Ladies, they have to have their pap and mammos completed at age appropriate. Gentlemen have to have their prostates checked. And unfortunately, through this process, we have seen catches of things like early stages of breast cancer, prostate, elevated prostate that needs to be addressed prior to transplant. So it can feel really irritating that you have to go through all of this, but I just want to reiterate how the intentions are good, and for the better journey for you after transplant. Other health conditions, very important. Oftentimes we are not kidney disease in a bubble, right? Diabetes, hypertension, have to be really well managed because there's a new person going to come and join your body unit. It's this kidney, and it needs to have a pretty safe home to go into because it's not its native land. So really want to make sure that you're following up with your primary care doctor annually or as recommended, and then with your other specialists as well. And then this is where I come in. This is the psychosocial, for lack of a better word. It kind of is all other things as a sign. And it's really your mind. Miss Shantae has a beautiful mind and spirit about her journey, as difficult as it is. And some of us don't naturally gravitate towards a positive outlook. And that's not a bad thing. It just means maybe you need some additional support. And since we know that this surgery is something that we can kind of prepare for, let's take this time and get you that support. And that's also looking at social support and environmental factors. Like it's very dangerous if you are living a homeless lifestyle to receive a kidney transplant and be out on the streets with immunosuppressant medications on board. It's like putting a big bullseye on your forehead for all kind of opportunistic viruses floating around the world. So we don't want to do that. And we also want you to have a great quality of life. And so if homelessness or something like, the threat of eviction or repossession of a car or joblessness is something that you're facing, there are resources out there. The American Kidney Fund is a great resource if you're looking for support and education. So I just wanted to throw that in there. But just wanted to kind of give an overview of what the intentions of the evaluation process is. And I do want to add a little note here that just because you attended an evaluation at a kidney transplant center does not mean you are on the list. Oftentimes that's a misconception where like you come, you do your evaluation, you go home and you're like, okay, phew, that was a big day or multiple days. Some transplant centers take multiple days to complete an evaluation. But until you actually receive your letter that says you're on the list, completing the evaluation does not equal waitlisting. So that'll lead me to my next slide, please. We'll talk about the wait list. So it's really important that you know that one single person does not decide transplant candidacy. It really is a team approach. And it's wonderful because we all have our specialties and our strengths. And some of our weaknesses as people and as practitioners are elevated by our fellow teammates coming together and having the conversation. And really, again, the whole goal is, does this kidney transplant ultimately improve this person's quality of life? They kind of talk about the risk-benefit analysis, like is the risk of a transplant surgery worth it to this patient so that they will be healthy and have a long and happy life after transplant? And so the interdisciplinary team meets, we look at all of our assessments, all the information that we gathered from you, what you presented medically from your past and present and documentation that we were able to gather from your various testing. And we decide, yes, you're a transplant candidate. That's wonderful. You will be waitlisted, or no. And why not? Why wouldn't you be a candidate at this time? Is there something that you can work on? And that'll come in kind of a form of a letter. Everything is in written form so that it hopefully is a document that you can reference back, but also something that your transplant team would be more than happy to discuss with you. It's not meant to be secretive or to sneak up on you. It's all meant to be for what we hope to be your best case scenario in terms of living a good quality of life. So what does it mean to be on the transplant list? So we could talk days about that, but maybe not days, maybe just a couple hours, but I will not fill all of our time talking about that. But specifically, when you think of a list, you kind of think of Santa's list, right? Naughty and nice and a long scroll and it rolls out. Well, I've learned in my time, it's not a list, it's a database. And you are entered in this database that is monitored by and controlled by UNOS, United Network on Organ Sharing. And it's complicated. And so we won't get into it, but unfortunately unable to ask the question, where am I on the list? So different regions and transplant centers have different wait times based on the number of organs available, the number of transplants they do in a year, the number of patients on their wait list. There's a lot of things to consider. when you think about waitlisting, but I really wanted to speak to being active or inactive. These are things that are more in your control as the patient. And what that means is when you are active on the wait list, that means that you could be called at any time. Getting that call, like Ms. Shante spoke of, is, it's almost like reverse pregnancy, right? Like you're expecting a child, but you don't have a due date. And it's very anxious, and you answer a lot of robocalls and spam calls, and it can be very frustrating. But when you are inactive on the wait list, you're still accruing time. So, like your time that you started waiting for a kidney transplant continues, but you won't be called for any organ offers that may match you, which is really unfortunate. And we work really hard, our waitlist team does. To get you active again. So what happened? Did something happen where you were hospitalized, where you received a blood transfusion, where you're weak and need to recover? What, is there something modifiable that you just need to complete, and then you're active again? And so all this is speaking to being transplant ready. It's very different than just being on the wait list and kind of parking it there and, waiting for your call. It's about being active in your healthcare, engaging in things like this, health conferences, informational sessions, keeping yourself aware of what's going on. As unfortunate as it is to need a kidney transplant, this is the time of great innovation, medical advancement. We've been doing this for a number of years now, and we got a pretty good recipe down. So I really encourage you to soak up the information that your transplant centers share with you, listening to conferences such as this one, and asking questions. It's not a dumb question. There's no way you can possibly know all of this unless you ask the question. So I'll continue, I'll quit harping on that and ask for the next slide, please, where we look at the time of transplant. And it's very exciting. It's a whole whirlwind of emotions, and Ms. Shante covered that so beautifully, that it's a lot. And great, now I have my transplant. Well, now what? And now the rest of your life begins, right? And I think that we in the professional setting could do a little bit better job of preparing you on the front end, that when you get your kidney transplant, you're not done. It's not over. We didn't cure you, unfortunately. We just treated your kidney disease differently than dialysis. We put an organ in you so it'll continue to do the work that your dialysis machine did for you without the machine. So it's wonderful. It's fantastic. Your life is liberated. Your diet is liberated. But there are things to be very mindful of. And one of those is medications. Your medications are so important. They are the lifeline of that kidney to keep your body and your kidney in kind of this homeostatic relationship, accepting each other and working as a unit. And so oftentimes, especially right after transplant, your medications are modified quite a bit, and making those modifications and understanding what that means and asking questions if you don't, and reaching out to your transplant team if there's a copayment that you can't afford. Don't be a silent martyr and sell your whatever piece of your body off to afford your medicines. There's a lot of great resources that we have at our disposal, but we do need to know if you are struggling with a copayment. Appointments are so important. That's your opportunity to check in, gain information, learn where you are, especially your lab values. That's the way that the team can help monitor and keep that kidney going for a really long time. And make sure that you communicate. Please, please, please. This is not the time to be silent. This is the time to share, overshare, and ask questions, and make sure that you and yourself and your body understand what's going on with you, because this is never something that's been happening to you unless you've had a transplant before. There's no way for you to know what's normal or what isn't, or what's a good feeling, a bad feeling. So we really encourage you to communicate with your transplant team. I'll move on to my next slide, please, and just kind of sum it all up for you. What I had to say here is, I don't mean for you to take this away that you should do this all by yourself. I know that we have a lot of independent albeit maybe stubborn, if you'll be honest with yourself, people that maybe don't share what's going on with them with anybody because you don't want to burden anybody and you don't want to, put your business out there. But I just really encourage you that there are 37 million people in the United States living with kidney disease, and albeit not quite all of them are needing a transplant, but we walk amongst each other and we don't talk about it and we don't know who each other are because we all are silently carrying this. And I just really encourage you to share your story, talk with people. You don't need to ask them for their kidney, but maybe you can ask them to help spread the word that you need a kidney. And your transplant team can kind of help you figure out your script or your dialogue. Take the time to do what you need to do. I've talked with so many patients that get really anxious because this particular transplant center that I work with, we have a 90-day window that we ask people to complete their testing. And we don't really intend for them to get it all done in 90 days, but start working on it. Like, don't let this go by the wayside. Please be diligent. Have a sense of urgency. This is your life. There is no quality of money we could put or pay you to make you feel the urgency of what you need to do. This is for your good and the benefit of your long-term life. And we need you here. So please do what you need to do to get done and get listed so you can get that kidney transplant. Your mind is powerful. It will direct your body against all odds. And you just really need to make sure that you get your mind right. And if you need to talk to your doctor about medication, connecting with counseling, it's okay. That you're not weak. You didn't do anything wrong. This is hard. It's really hard. And your mind has to be right here with it, or it's going to drag your body down with it. And last but not least, plugging into your community, just like you are here today. Thank you so much for being here. I'm so proud of you for taking this time. Not that I'm the be all end all that you need to listen to me, but I just want you to know that there is a community here for you all the time, ready to wrap their arms around you and tell you that it's okay and that it's going to be okay. But you can go ahead and have your cry because this is really hard. And I'll ask for one more slide change, please. I just want to kind of speak to resources. We are so blessed in the kidney community to have a wealth of resources. One being topmost is the American Kidney Fund. I can't say enough about the great programming the American Kidney Fund does, the great resources that they offer. I can't say enough how fortunate we are to have them. I also want to get a shout out to the National Kidney Foundation, the American Association of Kidney Patients, Dialysis Patient Citizens, Donate Life America, and then each of us has an organ procurement organization in our little region here. So I live in the state of Georgia. We have one organ procurement organization called the Lifelink of Georgia, and they have a wonderful foundation that helps patients as well. So just really want to let you know that there are things out here that have been created to help wonderful people just like you, because it's been identified that this is hard, but it's doable and there is support. So I just can't thank you enough for your time and listening with me today, the American Kidney Fund, for working so hard to bring information to you in a virtual, easy to digest format. And I'm just thrilled to be a part of it. So thank you so much for your time.
So much, Hannah, for all that information. So now I'd like to turn to our audience members for their questions. So first up, Dr. Koo, can you speak more about the specific testing during the evaluation and the reason for them?
Sure. I think Hannah touched upon this a little bit as she reviewed the evaluation process, but a lot of the evaluation is designed to make sure that the candidate who needs kidney transplant surgery can safely undergo the surgery and also receive medications afterwards to suppress the immune system without putting the candidate at risk. So a lot of the testing is cancer screening, making sure there's no cancer that hasn't yet been detected, that you wouldn't necessarily want to put that patient under your immunosuppression following kidney transplant. And so that's part of the testing. The other big bucket of medical testing is related to cardiac workup. So making sure that the heart is healthy enough to withstand the surgery and that there aren't any undetected issues that would make a candidate not a good fit for undergoing the kidney transplant surgery itself. And then, of course, making sure that patients have the social support that they need in order to succeed in managing their transplant afterwards is also part of that evaluation process.
Great. And also, can you just give a quick explanation of what tissue typing is?
Sure. So when all of us are born with markers that denote that we are who we are, and it's all very unique. And so tissue typing is to see whether or not a potential candidate for kidney transplant actually has what we call antibodies or proteins against other people's markers. This is really important because we want to make sure that when you receive your organ, your own immune system is not going to perceive that organ from someone else as being something that they recognize and will create antibodies against and start to attack. And so tissue typing is figuring out what are your markers and do you have any markers against other people's markers to decide which organ is the best fit for you or match for you.
Thank you. Hannah, is there a formula that determines where you are on the list, and how do you find where you are on the list? I know that you had said that it's a little sketchy on how that kind of works out. So if you can go just in a little bit more detail about that, that would be great.
Absolutely. And Dr. Koo, please feel welcome to chime in because my understanding is a little bit off, but there's a whole bunch of things that they take into consideration. Isn't that true, Dr. Koo? Could you speak more on that?
Sure. There is a point system that helps determine where you are on the wait list. Your wait time is, of course, calculated from the date in which you're waitlisted if it started before dialysis, and from the date of dialysis if you were not waitlisted prior to starting dialysis. But on top of the actual wait time you have on a wait list, factors that are considered include how likely are you to find a match? So in certain populations, they have antibodies against most of the population, and it's incredibly hard to find a match to an organ. Those individuals would get a couple extra points so that when the organ match does come up, they will get that offer just because it's so hard for them to actually find a match. If you were a prior living donor, for example, and you gave an organ to a loved one or someone you knew, you also get extra points if by chance you happen to need a kidney transplant yourself in the future. And so those factors actually factor into where you are on the wait list. But it's always best to check with your transplant center, and they can give you an estimate of how long it will take before you may receive organ offers. And that does vary by geographic region in the U.S.
Great. Another one for you, Dr. Koo. Does the recipient's body ever recognize the donated kidney as its own?
So there is a phenomenon known as tolerance, where over time, the recipient's body does sort of accept the kidney, and in those cases, less immunosuppression is required. In most typical cases, that does not happen. Certainly, if you have an identical twin, give you an organ, that may happen because you have the same tissue typing or markers. But it's pretty rare. And so the vast majority of patients will stay on immunosuppression for their entire lifespan of the graft or the kidney that they received.
Okay. Another question for Hannah. This is for you. If you don't pass your evaluation but have a living donor, what is next, and can they still receive a transplant?
That's a really good question. I know that's really heartbreaking when you go for your evaluation, you have a living donor in your pocket, and for whatever reason, you did not be determined to be a transplant candidate. And I really encourage that particular person to find out why. Why are you not a candidate? Is it something that you can address? Like, for example, did you have maybe like a skin cancer and just need to have a little bit of time to make sure that you don't have a recurrent cancer? Or was it something to do with your heart? Or was it a psychosocial factor that if you found more support, you'd be able to be a candidate. So at that point, and Dr. Koo, please feel welcome to chime in. My hope would be that the patient who has the living donor would pursue whatever they need to do to make themselves a candidate. But if their donor wanted to move forward with donation, they would be more than welcome to do so. But I know that's a really hard one for patients.
Yeah. All right, another one for Dr. Koo. This person is on the National Registry and they have high antibodies. How common is that, and what can they do to improve the likelihood of getting a transplant?
So about 20 to 30% of patients have some level of antibodies against others. And so it sort of depends on what level of antibodies you actually have. Some proportion of the population, maybe 10 to 15%, have antibodies against almost every potential donor, and those are the ones who get extra priority on the wait list. So it's a fairly common process. It would be best to talk to your transplant center. There are some centers that provide what we call desensitization protocols, which are medications that are actually designed to remove those antibodies prior to performing a transplant surgery. Of course, if you have antibodies, you're much more likely to receive rejection. And so even if desensitized, that can actually occur more commonly, rejection that is. So it's best to talk to your transplant center, and not every center may offer these treatments. And so you may want to contact some other transplant centers if the particular one you were waitlisted at does not offer these protocols. There are also some new trials that have drugs that help remove some of these antibodies, or therapies that remove these antibodies. And so that would be something that you could also potentially look into.
Thank you. And one final question for you, Dr. Koo. What are the chances that someone who received a donated kidney will develop diabetes?
So there's nothing about the donation process that should predispose a donor to develop diabetes. At the transplant center, we tell all donors that they should live healthy lives and really exercise and watch what they eat so that they don't develop new diagnoses such as diabetes. But if donors follow those directions and see their doctor regularly, the percentage of donors who do develop diabetes is low in the US. I would say that's because donors are carefully screened, they're motivated people, they understand that they're taking a risk and they want to protect their own health following donation. And so they tend to be living healthy lifestyles afterwards. So the rates of diabetes are not that high, though it does happen sometimes.
Thank you. Wow, there was so much valuable information that was presented today. So, to close, I'd like to ask our panelists to sum up two things that they think are important to know about understanding the transplant options and process and overcoming barriers. We'll start with you, Shantae.
I would say maybe just don't give up. The process can be long and tedious, but if that's your ultimate goal,